ยินดีต้อนรับทุกท่านกลับเข้าสู่ Virtual Seminar ณ NIA Virtual Studio ของเรานะคะหัวข้อต่อไปว่าด้วยเรื่องของ Health Tech และ Med Tech นั่นเองค่ะเซสชันนี้มีท็อปิกชื่อว่า Opportunistic Change in Hospital Transformation นะคะอุตสาหกรรมการแพทย์จะมีโอกาสหรือว่ามีความท้าทายอย่างไรเราไปติดตามกันนะคะโดยเซสชันนี้โคโฮสนะคะหรือว่าร่วมจัดโดยย่านนวัตกรรมการแพทย์โยธีและศูนย์ความเป็นเลิศด้านชีววิทยาศาสตร์นะคะเราได้รับเกียรติจาก Keynote Speaker ของเราค่ะท่านก็คือประธานเจ้าหน้าที่บริหารในเครือโรงพยาบาลพญาไทเปาโลนะคะคุณอัดทองแตงแล้วก็ในเซสชันนี้เรามีผู้ดำเนินรายการด้วยค่ะก็คือคุณนิรุตศรีพวทกุลนะคะท่านผู้อำนวยการสายพัฒนาคุณค่าธุรกิจและเพิ่มพูนการเรียนรู้ในเครือโรงพยาบาลพญาไทเปาโลนะคะสวัสดีทั้งสองท่านค่ะ
สวัสดีครับสวัสดีครับ
เชิญเลยค่ะ
ครับผมเป็นที่ทราบกันดีอยู่แล้วนะครับตั้งแต่การเกิดสถานการณ์เกี่ยวกับโรคโควิด -19 เกิดขึ้นเนี่ยอุตสาหกรรมการแพทย์นะครับก็เป็นอีกหนึ่งธุรกิจที่ได้รับผลกระทบนะครับวันนี้ผมและคุณอัดก็จะมาเล่าให้กับทุกท่านได้รับฟังนะครับว่าผลที่เกิดขึ้นเนี่ยมันส่งผลอะไรบ้างเกี่ยวกับพวกเราแล้วก็ยังมีโอกาสทางธุรกิจอะไรที่เกี่ยวข้องกับสตาร์ทอัพที่สามารถที่จะเข้ามาร่วมกันพัฒนาเพื่อพัฒนาให้อุตสาหกรรมการแพทย์รวมไปถึง
In order to work together, collaborate, in order to have the better society, I would like to welcome Kun At. I would like Kun At to tell all of us that since COVID-19, the ambience or the atmosphere or the environment of working in our country, how did it change? Oh, many crises. Maybe in the dimension that during the 3 months, the atmospheres of the people working in the hospital, you can see very clearly that people nowadays very concerned about their own health. But at the same time, the thing that we encounter, people are afraid of hospitals. Yeah, they are concerned about their own health, but they're afraid to go to the hospitals. If it's not really super necessary, they will not go to the hospital. They will say, is it safe to go to the hospital? So when that kind of things happen, how do you make adjustment? For the hospital, the most important for the past 3 months, that is the preparation for the COVID-19. So you know the information very well that since we are the hospital, the most important thing is in order to prepare ourselves for the COVID-19. If it's not COVID-19, it's going to be the other kind of infectious or pandemic. It will not be away from us very soon. It will be still with us. We need to preparedness. We need to prepare ourselves because these are emerging diseases. Yeah, and then we know very well that COVID has very specific characteristics that bring all the pandemics within itself. So we need to prepare the preparedness. So we don't know when he or that COVID is coming back. How can we pursue our lifestyle that we can do our best among that situation? So we need to organize, structure the things in the hospital. Like you have the division, the adjustment in terms of services and also the practice, and even the flow of the work operation within the hospital, waiting area, the hygiene area, the safety, the prevention, the protection of the communication, and those are important. But now it's even more important. The more challenges that we need to seek the cooperation of the visitors or the patients is the appointments. We don't want to see the way that the people will come and wait for a long time anymore. That is very risky. At least they are afraid. Huh? They are afraid to be sitting around in the hospital. So the picture that we have seen, the hospital, they will have the with the waiting chairs with the distancing. So but once we have the kind of chairs that are kind of keep the distance, though we can accommodate less people to wait. Yeah, once we develop to a certain level, if you compare to the overseas countries, but we can do it better. But at this moment, it's something that we need to talk about it. It's about the dimension that we alone cannot do alone. We need to communicate with the consumers what kind of technology that we need in order to make an appointment procedures to be practical, easy to use. This is the first opportunity that can help the hospital to manage the queues or appointments to see the doctors. So just a moment, we said that people are afraid to come to the hospital, but many hospitals started to move the hospitals to the patients. Can you explain this to us? During the COVID, because we are big hospitals, we have chronic patients that normally we travel back and forth. But during this time, when the patients cannot come to hospitals, what can we do? So the technologies that we use once in a while, and then it turned out to be the important factors that we need to have, we must have. For example, in January, we were talking about what kind of technologies that we use. We said that, oh, helimed or heliport, we don't need, or telemed, there's no need for that because there's no response from the patients or from the consumers. But once the COVID hit, people all come back to the telemed. So that turned out to be the good technology that we can put into practice even to speed up the telemed. So we can use this one to the entrepreneurs. I would like to share with you that in order to implement the innovation, technology is not the only answer. But when you try to design the service pattern, you know that we need to go to see the patients. What are our goals? Technology is part of it, but the platform, how can we collect the serum? How can we do the blood samples? Yeah, how can we analyze for the doctor to analyze the results from the lab? So, okay, one person at home, one person in the hospital, how can they communicate? So we need the other supporting services to help. So how can we check the vital signs? How we check pulse? How can listen to the heart rates that has accuracy? So we need all these innovations or techniques. How about the blood samples at home? So we have the lab technician, we have medical team, nurse team. So it's not one alone. We need the whole package. So it turned out to be what you call the service innovation. And Kun At just said that we need some devices to link between doctors and patients. If we can monitor the during the time the patient's still at home, maybe it's better to come to the hospital like the old time. Because in the old time, like 3 months, you see the patient once, but during that 3 times, this is like a spot test. The more frequency you can check, the more frequency that you can keep the records. You can see the blood pressure, you can see the sugar level, you can see the weight. So that will be the trends. This is a new technology that the startups or the health tech startups can come in and collaborate in these kinds of services. Now, one thing good about the Thai people, because we are easy to afraid. So when we are easy to afraid, we use the face, we wash our hands, we like the way we were advised. What do you think? That I really admire, I'm really proud, and have a lot of confidence if you compare to me during the time of no, February, the beginning of the COVID. Every personnel in the hospital were so stressed out. But now I had much confidence because I believe that Thai people know what to do. We said when we have a COVID, we know what we have. We put on masks, we wash our hands, we have the alcohol chains about 6 months. If you want to go out, the social distancing, how far we should stay away from each other. So it turned out to be one of the characteristics of behavior. Because we need to train this one in the hospital. At the beginning of the COVID-19, we had a lot of train. We trained ourselves, our staff, until it turned out to be the habits. because one, you have to turn into the habits because your brain cannot think that fast. And Thai people are very, very able to do so. And then I believe that they work so hard among the government agencies and all the designs, all the things that had do this one. It was a great thing that they had done. So whatever the pandemic that will come, we have the basic knowledge in order to handle with the new emerging diseases. So for the hospitals, we have what we call the cohort hospitals. One thing I would like to share with you, when we have patients that are kind of say in many hospitals because all the resources are scattered around in terms of cost, because there's a risk of one building, one floor will be one patient, so that is costly. So we need the cohort. We manage the PPE, we can manage the places, we can manage the resources. So right now, among the private hospitals, we have prepared these things already, and we can handle the cases with more patients. We have more knowledge body to and more readies in terms of preparations for this kind of pandemic. When it comes to the citizens in general, we wash hands, we wear masks until it's a habit. But for the companies and for the stores, they want to create more confidence in their own operation office. We had a lockdown. We had a certain period that we had a lockdown, and now we are opening the shopping malls, and they want to show that their shopping malls, hotels, that they safe for services. And how can the hospital help them out? Okay, from the learning that we had done, from the samples that Kun Bang just mentioned about during the COVID-19, I could see, I could see that in the business, like for each sector, we work as a silo. We work in silo. We didn't talk. Each business has its own business, has its own goals, has its own system, has its own way to serve the customers, and they enjoy their own work. They enjoy their own growth. They enjoy their own environment. They didn't talk. But one thing that happened that I was quite surprised as well, that in in the hospital we have the infectious control. These are the experts. These are the big guys in the hospital. They can answer what should be done, what should not be done. In, but within the hospitals, they are the important persons, actors within the hospital. But then, in the private sector, nobody asked. No, yeah, in the past, nobody asked for the advices. All these things, even though we were so ready and eager to give out advices. So when we see something quite unusual, like something that that's no need not to do, but 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 they try to create the innovations or the things, it will be more efficient if we go back the time and share the ideas among each other. So, do you have the other outside organizations to seek your advices? Yeah, from the we had coordinate with some hotels, some they call the ASU that we had. We talk with the hospitals, we talk with the uh, property owners, or some groups that we provide advices. And then in order to design the services platform, the hygiene services that will be more appropriate to the situation, it's like to move the things that you practice in the hospital to the private sector. Yeah. And one thing that we had done is the corporate sectors that they are about to open now, the contact points, what should they do in order to prevent all these communicable diseases. So the points, how many times they should check, how often they should clean up the airflow, how long the people can work in this room. So all these details, the experts have the answer for it, especially like an air hostess that have to provide the services to plenty customers at the same time. They will come and seek advices. Yeah, with all these pictures, it will have what we call the cross industries. So from now on, when we work across industries, will be more. And me myself, I believe that when we go through this COVID-19 or even what kind of pandemic that may come, the best practice to do is between the industries to sit down, to talk, synergize the things together, and ready to stand for providing advices. And it's fun. It's fun to learn together, work together. Yeah, and the cost and the efficiency that will come, and also to receive the direct advices from the experts, at least in within the hospital. The knowledge within the hospital is deep and wide, and each, besides, we have the food experts, communicable disease experts, doctors in all kinds of specialties, and we have the service teams, we have activity teams to look at the corporate activities. We have laboratories, and each side they have their own depth of knowledge. So it's not just COVID, but it's about the health care of the staff, of the people in the community. Yeah, each part of the unit in the hospital can go out and share the ideas and share the things with the outside hospital. This is a new normal. I would like it to be like that, and this is an opportunity to start this kind of new normal. Now come back here again. I have heard many times when we talk to the startups people, many times that the startups try to make contact with the hospital, especially the private hospital, to introduce products or the gadgets. But majority of hospitals don't want to talk to them. Can can you tell other startups about your ideas from the private hospitals that sometimes their development's not flexible enough? Okay, let's start from the things that I just shared with you. That in the past, the priorities in the we work as a silo, and hospital is hospital. And then when we started to have innovation within ourselves, like in my opinion, it's an internal loop within the hospital among us, is the, I would say, like a internal development or internal innovations. This is a good time. When you said we cannot stay alone, we cannot live alone, we need to synergize, we need to share. And among us, we set up 2 business units. I want to talk about this, what we had done so far. The very first one, we call the Paulo Center of Innovation. It's a lab in order to have the ecosystem for the innovation. One is to transfer knowledge for those staff who started to have the ideas and to understand more about innovation and adjust themselves within our organizations. If you have then ideas about the innovations, we have the support team. Otherwise, you said that, okay, in the old time, we had a new idea. Before it gets to the executive, it's a long, long ride up there. But we try to set up the ecosystem that ideas can be materialized. So with this one that you call the pill, okay, yeah, it has important aspects. Like I told you a moment ago, if we let it go, it will gonna be within our internal loop. We want to spark the ideas. We need the new ideas. So pill will go out to the other thing and to see all the innovations, to see the techniques, and then bring it back to update the people about the new service, like to see the out-based practice of the others, like a lesson learned from the others, to bring back all the things. It's not to implement with them, but want to work with them to see what kind of technologies that they have outside there, that we can work together the thing that is very powerful, like many listeners who said that you are in this, you were in this ecosystem before, and now you get to know the NIA, or to be one of the, to know about the food monopolists, uh, and government agencies, many agencies so powerful that once you work with them, but once the corporate work with the government agencies, I see many opportunities to help each other out. Is there any response back from the corporate once they work with the private hospital? What did they get from doing so? They were excited. They could see one thing, that by being a hospital, the roles that I think we have that we can help them is we work in research. We have the innovations continuously. One kind of skills that we have that very beneficial to them is to get the knowledge from our research to help the products, whether in terms of the products or the gadgets that will come out from the NIA or from the startups. Many of you probably have think about these products, and you can say that how come we cannot sell these things to the hospitals? The secret is, before the hospital can implement or use it, we need a research base. We need to prove the efficacy of that product before we put into use, before we can implement that with patients. So the technology or the medical techniques of medical innovations, it takes time because it has to be safe 100%. You need to collect the data, collect the statistics. And this one, the private hospital can help you by doing so. This is the idea they call the accelerator. So on the basis of ability, we want really have the intention to help to to make the abilities of Thailand, or the to really capitalize and get into the hands of the consumers. So we set up what we call the CPRIA, Center of Private Research and something accelerator. So that will bring us back, speed up the innovation to the end consumers. Yeah, the research need the protocols, the research that need to talk to the nurses, you need to talk to the doctors in their own languages, because innovations come in from many fields. And the important points is not just on the FDA, and then you can put into use when you get the FDA certified the safetiness, but to implement, you're talking about productivity, you're talking efficiencies, we need the research statistics data. Yeah, many times. Okay, say the products the startup had provided, they got the FDA, but they cannot uh, uh, put into the hands of the doctors in the hospital. Yeah, it's not, that doesn't mean to attract the interest of the doctors. It has not gone through the testing period that once you use it, there's a convenience, there's the benefits to the patients, and how can you quantify those kind of benefits to the patients when you use those products? So we need the knowledge, we need the experience, we need the research in the field of health, of doctors' idea to put in together before we really implement. Private hospitals, they probably have to adhere to the standardized, and then you know that somehow it differs from the government public hospitals or the university hospital, because these are the things that the patients, they have to pay out of their pockets directly. Yeah, both private and public hospitals, from the point of the concerns of the concerns about the patients, not much difference though. But at the point where before we can bring the innovation to the end users is the one that we can put ourselves in and help. This one we can close the gap between the upstream and downstream down together. So many researchers that we had done, whether it's one the YMIT or NIA, about the AI, artificial intelligence, Yeah, that would be very beneficial because when the risk of having the COVID-19 is because no symptoms, asymptomatics, okay. If there is no symptoms, how can we check, how can we test that person for COVID? Now we can use the X-ray machine that is completely portable. We can X-ray and we can see lungs and using the AI to do the analysis that how risky that person is to have the COVID-19. This one can help the medical personnel. And the one thing that sometimes the people who are not in the ARI, they may be, because no symptoms, they are not in the criteria of being having COVID patients. But COVID is so smart, they can hide, they can be somewhere where we cannot find the COVID-19. Yeah, this is a very good samples here. This is the temperature check, continuous temperature check, especially from children. One thing, this is a sample. This has gone through testing. They have products, and they receive the FDA, but not a single hospital use. But when we set up the research, we can see once we really implemented that long time that we use, is there any allergic reaction to this one? How many people are allergic to this kind of gadgets? And is it comfortable? If if it works according to the functions that it was designed to, but if it's not convenience, we took a couple years to adjustment until it's really put into practice. And I'm so glad that it's really workable now, and we are the customers of that products. And the next one is about the pharma, about and then this one has already put into use because the people started to be alert about the digital, that we need the platform for the appointment. We would like the people to come to the hospital and have an appointment before. When we have the app for the appointment, then we can add on all these tools. The report can be online. They're like about the medical, about the medicines, the safetiness of the medicines, or even to warn which medicine you should take now, before, or after. And then this one sometimes when we go back home, and then we put the medicine, and we put the medicine on the table, and then we forgot, oh, they look so alike. What kind of medicines are these? These kind of gadgets can tell you to identify what kind of medicines that you have. Now, the picture of the Payathai Hospital and Paulo hospitals, maybe, okay, you can say a little bit more about that one. Some audiences may not be familiar because Payathai Paulo is a brand for Thai people in majority. And lately, we started to expand our market to the foreigners, or to international market, Cambodian, Myanmar, that have our neighboring countries, neighbor citizens that have quite same culture, and the level of the medical more or less the same. So we expand ourselves to their communities because the majority usually is a middle class. For the Paulo Europe Hospital, we also serve the people who under the scheme, social security scheme. And then lately we started to emphasize on the specific or specialized sickness. Our goals, we want to see the people in good health. And next, for me, I would like to do the corporate marketing. Yeah, the good health come up with the healthy behavior. So if we can adjust, we can have a healthy behavior, we can have the healthy lifestyle. And in the corporate, because in our life, we spend 1/3 of our life at work. So we are trying to turn to the corporate, because once we can pick up the corporate, because we have the mass, mass end users, because if we can create this kind of healthy culture within the corporate, when the people in the corporate have good health, they will go back to their families. Have you tried? Have you tried to this one within the Payathai and Paulo? We had done the research about this one already within our organizations. We bring the data about the health checkups with the survey algorithm, and then we do the analyze and and then try to design the activities and health promotion for the people. Oh, this one can be expanded to the other corporates. If any of you are who are interested, you can contact them. Maybe Kun At can explain to us about the customer journeys. There is one particular slide that we use during the COVID, because we have to adjust, we have to disrupt ourselves in what way in order to handle the COVID-19. I would like to see, okay, this one. If you look in terms of the customer journey, in terms of health or the preventive, we are talking about preventive, and then before you get sick, okay, you are still healthy. What can you do? Like, you can do the checkups on a regular basis, and the information that we convey to the patients. And this one, you can do the nutritions, diet recommendations, vitamins, and that can link to the products, and also the service app that we can use. Many of them. In terms of wellness, we have the patient's data that we can propose all the information to the patients that will fit for them. It doesn't mean all the information or the junk information. And the other one, now, when we are talking about the sickness, the patients have to come to visit the hospital quite often. How can we deliver? Or even the telemed, so the patients don't have to come to the hospital quite often. And this next one, if they had fever, they don't feel well, and how can they get access to the doctors as soon as possible? And the other one is post-care, after the hospitalization, and then they go back home. What kind of service we can provide? So the whole journey here, the startups can get in to help to develop all the things, all the steps, and all the products that can help through the journey.
And many startups wanted to ask for data from us, but as a hospital, we may not be able to share data with you so freely. And what we are doing at the moment is we are compiling patient algorithm. And so with consent of our patients, we may be able to allow some matchup. For example, if you have the potential products or services, we may be able to offer them to patients who have granted consent. That's one way that our partners or startups can work with private hospital groups like us. And at the last few moments, I believe that we have a question for you. What are opportunities for partnership from your perspective as an executive of a private hospital group? Well, there's so many opportunities throughout the customer journey. Well, there are opportunities throughout. And so one of the ways on diet and wellness. How can we use diet and nutrition to prevent diseases, probiotics, or use of supplements to promote health and well-being, and food products that serve specific needs. These are some really good opportunities. Any other questions from the audience? Well, I think we are running out of time. If you want to contact CPRIA or PIL, this is the address to get in touch with us. And so that's from our side. Thank you very much. We have just heard about hospital transformation in order to promote innovation ecosystem and strengthen partnership with startups in order to bring about better high quality services to patients. I'd like to thank Kun At Thong Tang and Kun Nirut Sri Pawatagun, our moderator from Payathai Hospital Group and Paulo Hospital Group. The next topic is on energy tech and green tech. The topic is Japan policy and technology trend in green tech at 1 p.m. After the